Hi guys, I'm Dr. Ngozi Onoha. Today I will be talking to you about how to take care of your skin if you have acne. What is acne? Acne is a chronic inflammatory skin condition affecting the face, the chest, the back, and the shoulders. So, acne can appear as blackheads and whiteheads or inflammation which looks like little bumps, papules, pustules, cysts, or nodules. So, who's affected by acne? So, acne affects mostly teenagers. Adult acne can be present. It is most common in women between the ages of 20 and 40. Even though acne is not dangerous, it can have a psychological effect on the people affected. And early treatment of acne is best because it prevents the post acne scarring and the hyperpigmentation that is seen after acne. So, this is important. Do not pick or squeeze pimples. Picking or squeezing pimples causes infection to spread, it causes pigmentation, and it can cause dangerous infection if the infection spreads to the brain. So do not pick pimples. So I'm going to tell you how acne is treated. So the diagnosis is made by a physical exam. And acne can be classified into mild, moderate, or severe. So, with the mild acne, there may be some white or blackheads and just a few inflammatory bumps. Those bumps I mentioned to you earlier. So, moderate acne is present if there are lots of bumps. So, the papules, the pustules, and the nodules, as well as cysts that I mentioned earlier. There can also be quite severe acne if there are large papules or bumps or pustules and just a lot of cysts covering a large area of the skin. So, for the most part, mild acne can be self managed. And for someone who's not pregnant, there is over the counter topical retinoid. And this is sold over the counter, as mentioned. It is typically used at bedtime. And during the day, in the morning, a benzoyl peroxide cream can be applied. This is especially useful for spot treatment of acne. If there are just a few acne um, lesions and it's not all over the face, then one can just apply the benzoyl peroxide just with a Q-tip or the tip of the finger to those acne lesions. A topical antibiotic like clindamycin can also be added uh, to the benzoyl peroxide. If there is acne on the shoulders, the chest, or the back, a body wash containing 2% salicylic acid might be helpful. Now, for people who have moderate or severe acne, oral antibiotics or spironolactone or isotretinoin may be prescribed by a dermatologist. So, what's a good facial skin routine for people with acne? So, a general skin routine and one that I've used myself is to wash in the morning, wash your face in the morning with a mild cleanser or Dove soap or a 2% salicylic acid face wash, especially if you have oily skin. apply your acne product, which could be the benzoyl peroxide or a topical antibiotic or both, and then apply sun protection factor cream. This protects the skin from the damaging effects of the sun rays. At night, cleanse twice. So when I say cleanse twice, you can use micellar water on a cotton pad and clean the face, and then use a mild cleanser to wash. If you don't have the micellar water, you can use Dove soap. Apply a retinol gel or cream. So you can apply your retin-A or different gel at night. So those products are best used at night because retin-A is sensitizing to the sun. So that is why they're used at night. And then apply a moisturizer after that if your skin is dry. So this is just general health education. I know acne is very common and people struggle with it, and it needs to be treated sooner rather than later to prevent acne scarring. So the longer acne is left, the more the chances of having acne scarring and hyperpigmentation of the skin, and that can be quite distressing for people. So it is important once acne starts to show up. It's very easy to buy medication for acne over the counter. So when I say that, it's the retin-A and the benzoyl peroxide and the face wash or the Dove soap. Now, any other soap might be drying, so it's not generally recommended to use soap on the face, but Dove soap is mild and is useful for people who have acne. Thank you.